Hi, I'm Charlotte Jolly, Beauty Director at Hello Magazine, and I'm joined here today by three of the UK's leading aesthetic doctors, Dr. Nina Bal, Dr. Raj Arora, and Dr. Mariam Zamani. We're here to talk about what's new in aesthetics, and I want to start by asking Dr. Nina about what she's seeing in clinic, what trends are emerging.
So I still believe we are in that post-pandemic phase where there is still a very big increase of requests for non-surgical facial aesthetic treatments. But so often what I'm seeing is that a client comes with an idea of a potential treatment plan that they think is what suits them, but actually after a thorough examination, that's not the right thing to do. So it's that combination of wanting to know and being really hungry for knowledge, but equally being so confused because there's so much out there.
And does that ring true with you as well, Dr. Raj?
Yeah, I think I'd follow on from what Nina's saying. So actually you're seeing a lot more of this self-realization. You're looking in the mirror a lot more, picking at your wrinkles, any texture you might have. So I've had a lot of patients coming in and saying, I don't like the way my nose droops when I smile, or, there's asymmetry on my cheeks. So they may think they need a certain rejuvenation or a treatment, but I think once you've spoken to them and sort of run through the options, you'll go through what else there is on the table and sort of give them a profile balancing. And also starting with the canvas, which I love to do, which is the actual skin. So I might say once the acne and the texture's gone, you might not be so bothered about tiny bits of asymmetry. The other thing is, I think I'm seeing a lot more of the trends of lower face tightening. So it's a big thing. They don't want to go under the knife, they don't want to have so much downtime. So I think this whole idea of what else can I do, what's out there now that I can do to myself, which is not going to give me so much downtime or even massive drastic changes in the way I look. So little small things that are going to make me feel a bit better about how I look, enhance me, but not a drastic change. So that's definitely the kind of trend I would say I'm seeing more of.
And what are you seeing in clinic, Dr.
I agree. I mean, I see both surgical and non-surgical, so this is the perfect time if something bothers you to get it done. People are much more educated, they're also more informed, and they've also seen a lot more procedures done on social media, so it's not as taboo as it might have once been. But I do think the consumer and the patient that comes into my office now is very well educated. They know what's out there. They know topical skincare ingredients very well too. They've researched different treatments, and they want a combination. They want to treat the skin, they want to treat the volume loss beneath the skin, and they want to approach any bony changes that happen. So it's really looking at it at every level of the skin and the face and the neck and the décolletage and now body as well. So, I think it's all part of the whole live well, feel well, look well. So, you need to have all three of them together, and I think it's a movement that's here to stay.
Yeah, it sounds like skin health is a really common trend among clinics. And leading on from that, why is a well-being approach really important when we're talking about aesthetics? We see so many clinics setting up in well-being settings now and offering like a more holistic package. Why is that so important?
So my approach when it comes to aesthetics and beauty is very holistic. So I take my consultations very seriously, and even before a potential client comes in the room to speak to me, he or she has to fill a lot of questionnaires. So not just only personal information, medical history, but also GAD questionnaire to really screen anxiety, depression, potential body dysmorphia. So I really want to have a very good idea of what's going on behind the scene of someone requesting facial aesthetic treatments.
Dr. Mariam, I know this approach is what you do in clinic as well.
Well, I think it's really important. Obviously, we all have these incredible questionnaires and really try to get to know our patients. I think continuity of care is really important. So often, most of my patients are return patients. I know about their lives, I know about their families, I know about their work, and we have an open dialogue as I'm preparing things, as we're discussing what bothers them. So I think having that relationship is really important with whomever you choose. I also think it's really important to supplement what you're doing in the office with what you're doing at home. I often tell my patients, I'm doing all these great treatments for you here, but you have to support that with your good skincare routine and healthy lifestyle at home. If you're out partying every night, drinking champagne and smoking cigarettes and coming and having a nice laser or injectables with me, you're not doing yourself any favors.
And Dr. Raj, I know this is really important to you as well, isn't it?
It is, yeah. Actually, my clinic is in a wellness retreat. So the reason being really that we know that research shows that the way we look impacts the way we feel and vice versa. So I think more so now, like Mariam was saying, it's really important to think about the patient as a whole, you know. And of course, we have these questionnaires that we can screen for anxiety, depression, you know, body dysmorphia. But there's always a client that kind of slips the net, you know, they're not quite fitting one of those boxes, but they definitely have stuff going on or that's triggering them to get a treatment. So I really like to get to know my patient. Maybe it's because I'm a GP as well, and that's ingrained in me to have that rapport. But I want to get to know what's driving them to have a treatment, what's going on in their life, you know, I want to get to know them, their family. And I think that really brings a beautiful relationship where I can be very open with them and they can be very open with me. So I think there's a rise of new doctors now who, and clinicians and aesthetic practitioners who are trying to preserve the way one looks and to get to know the patient a bit better. And I think that's really important.
I think actually that's a really good point, because in my practice, for instance, it's not necessarily about looking different, it's about looking your best self.
That's it.
And giving that person confidence that they might not have had when they're looking in the mirror.
That's obviously incredibly responsible. So when we're talking about practitioners and industry standards and regulations, do you think that the industry is regulated enough? And if not, do you think that practitioners should be held to a higher standard? I'll ask you, Dr.
Absolutely. So I mean, I'm definitely newer in the industry to these lovely ladies here, and I look up to them enormously. But the route I think one should take should always be a very organic, you know, route where I think you have to be accountable for what you're doing. You have to have responsibility. You have to be able to say no as well. You know, you're not obliged to treat a patient. You are treating people. You're treating their emotions. You know, it's not something to be played with. I think you have to be very responsible in the way that you treat them, and also ethical. You know, it's important not to make everybody, like I said, into a clone, and to sort of treat each person as an individual. What we see a lot of right now is, I think, the drive from TikTok and Instagram and social media, lots of influencers injecting. I mean, nothing really worries me more than that. I think we need to have tougher regulation. It is kind of getting there. There's more conversation around it, and there's definitely more sort of guidelines to be followed, but we need, I think, a lot more to regulate that a bit better.
What's your take on that, Dr. Nina?
Unfortunately, our industry is really not regulated enough. That's the bottom line. And I mean, just to give you an idea, just October last year, there's the law that finally passed that under 18 cannot have non-surgical aesthetic treatments.
And in my opinion, I don't think any of these procedures should be done in a salon type environment. I think they're regulated. There are some serious complications. You see someone who's specialized for that specific reason that they know what to do in a complication. Everything's fabulous until it's not. And when it's not, you want to have the person who can get you out of that situation.
Before you get to the complications, it's also about knowledge of anatomy and, you know, your medical backgrounds. They play a huge role in knowing how to treat patients.
Absolutely. That is very important. And what I often see I just see a lot of patients who have complications, and when they come into my office, sometimes they've gone somewhere else and it's been told to them that they just have a bruise. And I can see the modeling, I can see that there's some sort of occlusion or there is some sort of blockage of blood flow. And the fact that the person who was injecting at the time wasn't able to recognize so that they could get adequate treatment to prevent any long-term side effects that might happen from such a treatment is really important. And of course, we all can get complications, but knowing how to treat them in a timely manner is really crucial.
On a lighter note, can I ask, if you were to walk into your clinic as a customer, what treatment would you have and why? I'll start with you, Dr. Nina.
So, I would ask myself, I think two things makes me so happy when a potential client comes and asks me. First of all, I'm not very happy with my face shape. There's something going on. I can't really pinpoint exactly what it is. However, in photos on screen, I'm not happy. Can you help me to figure out exactly why? I love that because it really allows me to use my dental knowledge, medical knowledge, aesthetic knowledge, and really calculate the golden ratio of the face, analyze the side profile, and really create a treatment plan and explain why, and create a treatment plan to help that person. Second situation that really makes me so happy if someone comes and say, oh, I really start to dislike the initial axis in my lower face and the jowls. The reason being is that I've got a really powerful combination of two treatments that I use, which is Profiler with the Endolift, to really give a non-surgical laser-assisted facial sculpting treatment to help very effectively with the lower face jowls. So I know I can help that person for an area that's very tricky non-surgically to treat. So that is my answer.
And Dr. Raj, what would you book yourself in for at your clinic?
I mean, I want to say everything, but I'll give my top 3 very quickly. So definitely, I think starting, like I said, with the canvas of the skin. So a quick skin visio scan to have a look at damage of the skin, you know, where we're going, simulating the skin, finding out the true skin age, and putting together a bespoke skincare routine to do at home. I call that the homework. And then in clinic, I would say, like Nina said, it's very tricky to treat tightening, you know, the gel. So for me, Morpheus 8 every day, like it's amazing. Not only is it great at skin resurfacing, but you really do see tightening of the skin. So radiofrequency microneedling, 100%. And then if we're talking holistic, I have to bring the body in. So I'd say M-Sculpt Neo. I wasn't actually sold at the beginning, but I managed to get abs after 4 sessions. So definitely an M-Sculpt Neo, yeah.
That sounds very impressive. Dr. Mariam, what would you?
I absolutely love everything that I do, and I want it all too. So I wish I had time to even do a fraction of it in my office, but I would definitely start with a Visio skin analysis. I think, one, it's a beautiful way to see where your skin is relative to other people, and also to tell you what things you might want to work on. I also love that you can simulate and see what you might look like in a few years' time. Not everybody wants to see it, but it's a really nice thing to be like, oh, you know what, that's probably exactly how my mother aged, and that's what I'm going to look like. So I'd always start with that. Obviously, I have my own skincare line, so I always create a bespoke skincare treatment protocol, but for me right now, Moxie with BBL is my #1, and it's the first thing I did when I came back from summer, and I absolutely love BBL Moxie because it helps to clear skin from pigmentation while boosting hyaluronic acid and collagen and elastin production. So it's one of those fabulous treatments that all skin types can use, and it really gives that hydration and that polished look to the skin. So pigmentation, refines pores, even outs redness, and just boosts collagen and elastin production with almost minimal downtime. It's a really nice treatment that I think is really beautiful for all skin types.
Well, that all sounds amazing, and I would like to book in for all of those treatments, please. I found that really interesting. Thank you so much for joining us today. I hope you found that interesting at home, and hopefully it inspires you to start exploring the world of aesthetics.